As you've seen from this morning, since 3 years, treatment of musculo-skeletal disease by collagen injection is developing in Vietnam. You know, knee osteoarthritis is a chronic condition causing stiffness, pain, and loss of movement in joint, and is the most common type of arthritis. And as many countries in Vietnam, knee osteoarthritis is very common. It affects all components of joint, and it could be the reason from a complex interplay of multi-factors, including joint integrity, gene, local inflammation, and biochemical process. And as you see, collagen account for about 5 to 6% in adult body weight. They are the white red structure component of extracellular matrix. And the common site of collagen is triple helix structure in the molecule. It provides the tensile strength and form of cartilage. And MDNE is a product in the collagen Guna group that contains collagen derived from swing oxygen collagen. And collagen in the MDNE helps to restore the structure of the endogenous collagen. From collagen, application as a medical, cosmetic, food, and now I have no some study about animal model. The first study the intravenous administration of type 2 collagen in an effective way to induce tolerance and suppress disease in the collagen-induced arthritis model. In this study, they demonstrated that a single IV dose of type 2 collagen completely prevents the development of CAE. Another study, the low dose of native collagen type 2 applied repeatedly to rat orally before immunization resulted in inhibition of collagen-induced arthritis and also induced arthritis. Similar effect was observed by fragment of collagen type 2 synthetic peptides of collagen type 1. Another research artist, our colleagues from the Japanese to carry on osteoarthritis to carry on in right knee in 72 Japanese white rabbit, and they was divided into 4 groups. Each material was injected weekly into the knee and knee joint sampler was completed 5, 10, and 15 weeks after surgery. And the result on treatment group exhibited slightly higher resistance the progression of osteoarthritis than the control group. And the conclusion periodical injection of CTP and CTP combined HA delayed progression of cartilage degeneration of early osteoarthritis. Another research, they conclusion collagen fibrinogenesis is an essential process for the formation of macromolecular biological scaffolds. And some clinical study, one research, this study to investigate the effectiveness of the collagen inject Guna MD knee and MD matrix for pain and daily function in symptomatic knee osteoarthritis, degree 3 to 4 X-ray state by Collagen high frequency ultrasonic is an approved imaging technique for diagnosis of joint swelling and monitoring of therapy. They study on 22 patients aged between 62 and 79, including and exclusion criteria are present on below. And the result is very hopeful. They conclude the effect of Guna MD improve the quality of life of patient, and effective of Guna MD continue after stopping treatment. Another research, they studying efficacy and safety evaluation of Guna collagen MD injection in knee osteoarthritis, and a case study of 30 patients. And the conclusion, articular injection of Guna MD result is in a significant improvement of pain and rest, pain during movement and function activity in patients with knee osteoarthritis. And as many countries, in Vietnam, the patient, my patient have many choice to treat KOA. They could use traditional drug, modern drug, and rehabilitation. And we can do injection into article for them, so that we to carry on the study to assess MD knee safety and active need of OA knee primary. The patient, in conclusion, we have 60 patients aged between 41 to 65 years with the diagnosis of primary knee OA according to the Asia criteria. Vast over 2.5 can and now radiological test 1 to 3. Exclusion, knee joint infusion on ultrasound image, intra-articular injection of physical therapy within the last 3 months, secondary osteoarthritis, cardiovascular disease treatment with anticoagulant, hypertension or diabetes uncontrolled treatment, after an injury or surgery on the knee. And the patient was examined clinical estimate pain score according to vascular pain score and knee movement function according to Guna index, made as X-ray and ultrasound of both knee, taken peripheral blood and biochemical blood test. Treatment, we used Guna MD knee 10 ampules in the following swim. During the first 2 weeks, 2 applications per week. During the next week, 1 application per week. In a single course of treatment 8 weeks, use meloxicam 7.5 milligram per day if the patient has a lot of pain. Time of evaluation, the W0 right before the first MD knee injection, week 4, week 8, and week 12 after 12 weeks of treatment. And the rerun of study with collagen, we have 11 men and 49 female. Average age for 6.3 plus 8.7 years. Can and radiological stage, stage 1, 11 patients, stage 2, 42 patients, and stage 3, 7 patients. And in the chart, you can see the changing the level of pain post-treatment. At the beginning, they have we have 55% moderate pain and 30% soft pain, and after 12-week treatment, we have 41.7% no pain. And you can see changing VAS score post-treatment. From at the beginning, the VAS is 6.7, and after 12 week 12, the VAS is 1.6. And the changing Guna score post-treatment, including Guna pain, Guna stiffness, Guna physical function, all reduced at week 12. And to estimate the side effect of the therapy, we also advise the characteristic hematology and biochemistry pre and post treatment, and we can see all the characteristic is not changed. And in conclusion, for my inclusion for our research, we can see collagen MD knee was effective, resulting in a significant reduction in assessment VAS Guna score from baseline at 12 weeks, and product is easy to tolerate patient and has not detected an undesirable effect during the monitoring process. And I show you a case clinical 65 years old woman suffer from diabetes mellitus and OA for 3 years. She used to be injected corticosteroid 1 time and HA 2 times into knees. 6 months ago, he was injected with corticosteroid after being aspirated in the left knee, then has been painful and had motion joy. When she came to meet me, the left knee examination, and it's difficult to walk, limited folding, got stiff knee with long motion listening, and increasing pain when changing position or pressing, and what's called is 7 point. Biochemistry test white blood cell called 9.2 cigarette and platelet called 178 cigarette. Sedimentation rate 20 and 30 minutes. CRP 6.0. Glycemic 6.8 millimole per liter. HbA1c 7.0%. Glucourine negative. Joy in ultrasound synovial thickness. X-ray image of state 3 over knee according to KNL. Which is the therapy to choose for treatment local? Corticosteroid, but she has diabetes mellitus. Hyaluronic, she had already PRP, but her platelet count was low, and MDN seems okay. And with treatment for her meloxicam 7.5 milligram, 1 capsule per day daily, during 3 days, and MDN injection according to the treatment. First 2 weeks, 2 milliliters MDN time and 2 times per week, and next 2 weeks 2 milliliters MDN 1 time per week. Observation 2 weeks was from 7 point to 3 point, and after week the pain is nearly gone. The joint operating is normal, and after 6 months the patient is very satisfied, no use and set, and we keep following her. And thank you for attention.